Hey there, this is Dr. Paul Gundian with First Choice Dental Center and Restoring 24 for another case study as part of our case study series. And our next patient is Mr. Mike. He's a 52-year-old male, and he has a lot of loose teeth. So he has severe periodontitis. And with the severe periodontitis, a lot of times out over time, and teeth will just start falling out on their own with the bone destruction from that bacteria eating away at the bone. And he was finally sick of it, and he wanted to be able to smile again. He wanted to be able to chew again. He wanted his teeth not to move and be worried about whether or not they're going to come out when he's eating lunch with his friends or at work. And we told him, yes, you're a candidate for Restoring 24. And we agreed to do his upper and his lower. We get started with that one. Here we go. This is Mr. Mike. This is how he came to us after his consultation, and he came for his pre-op, where we take your photos and just see where we started. And so as you can see here, he has teeth. He didn't love his teeth. There's a lot of gaps in between them, and a lot of that is because of the bone destruction. So his bone is supposed to be quite a bit lower, and his gums are too. So gums follow the bone, and here we're missing a lot of bone. We're missing some teeth on the lower and the upper. His teeth have become flared over time due to the lost bone structure, and he just did not like a smile. And he's excited, so you can see he's pretty excited in these photos, and he's a funny guy, and he always makes his appointments a good time. So here he is from the side and from the front. And here's his x-ray. So a little bit blurry. Sometimes we get blurry on certain patients, and it just kind of depends on their structure of their bone and how their uppers and lowers come together. But you can get an idea of what we're looking at here. So what I am looking at immediately is seeing just the amount of bone loss that he has. So the bone is supposed to be at what we call the CEJ, which is right around where this line is. And we are missing a lot of bone here. So this is all bone loss. So a lot of what we call generalized advanced periodontitis, infections up here. And so a lot of bone above the bone loss from the periodontal disease, not much here. And so what we would plan to do on his case is place 4 to 6 implants. And so on him, we have some bone up here that we can maybe tap into. We have bone in front of the sinus we could tap into. In the front here, another one tilted here. And maybe we can even tap into this bone over here. Then we get to the lower, more or less same as the upper. A little blurry, so you can't really see the bone loss quite as well in this tip x-ray. Bone loss here, so a lot of bone loss. And all of his teeth are mostly mobile. A lot of them are mobile. Some of them are very movable, some of them move just a tiny bit, and some don't move at all, but for the vast majority of the teeth, there's a little bit of mobility in those. So now we have the CT. I'm going to start with the upper jaw. So this is his very upper right, where I was saying we might be able to get an implant back there. So when I tilt my implant over here to avoid the sinus, I do see plenty of bone in this area here. We have plenty of width. 12 millimeters of width, that's a lot, and plenty of length here too, 19. A little bit less dense than we typically see in this area of bone, but that is not an issue. Keep going forward. A lot of bone loss, so this is actually a defect where this tooth was very loose, and you can see here where the bone and the ligament have widened. So this tooth is ready to fall out. And the sinus goes pretty far forward, so what I'll be doing is tilting an implant in front of the sinus. Here's the sinus, I'm tilting it in front. And then, so that's the second implant. And then plenty of width in the front here. Very straightforward, big infection here. So we're gonna avoid that site and move it a little bit farther away. So we'll go at his lateral incisor here where the bone isn't quite as destroyed. And then we'll move back and another one in front of the sinus. So we're gonna tilt here. Lots of bone width, lots of bone height. Come back here for the other pterygoid implant. More or less the same as the other side. Here's lower right. Plenty of bone width in the back here for one of my single implants. Back here, 12 millimeters, plenty of width. Like I say, I really need 5 at least in order to get this to work. 6 is more ideal. He has so much bone, there is absolutely 0 issues. I love to get cases like this. And here we go forward. I'm going to tilt. Here's the nerve. I'm going to tilt right in front of that typically. Plenty of bone width as we can see. Some bony tori back here, so those lumpy bony projections that he has on the back side of his jaw, and we remove those during the procedure typically. Big infection here, you can see that. So we'll just avoid that and place an implant next to it. Keep going forward. More infection. More tori on the back side. Plenty of bone width. A lot of bone loss in this lower left molar. And we got plenty of width and height everywhere, so this is a straightforward case. Here we go with his overlay photo. So this is what the lab designed for us. So I worked at the lab, and what we wanted to do is give him still a big smile like he had before, but just really idealize everything and make everything look nice and straight and pretty. So you have that all on the right here. Another photo of the overlay. So the blue is what he had before, and the white is where we were putting him. So with him, his jaw structure was pretty straightforward in terms of how his upper and his lowers came together. Some people have these major overbites or underbites, which will change up the teeth quite a bit more. With him, we just wanted to keep things where they were supposed to be naturally, but over time, with the bone destruction, his teeth have moved. So upper, lower. And here are the implants. So we did place 2 implants in what we call the pterygoid region, and bone was pretty good there. Bone was great in the front, bone was great in the bottom, 6 and 6. The only thing with these in the back over here is the bone was actually softer than anticipated. So usually the bone is very strong over there. So what I actually did was I buried those implants, and if we ever needed them, we had them. So think of like a spare tire. And as time went by and as everything healed, they integrated, but I asked him, hey, do you want to go through a little bit extra procedure in order to add these to the prosthetic? We don't need them. It's always nice to have them. And he said, no, I do not want to do that. If you think we are good with 4 on the upper, let's just leave those in the back where they are, and let's not go through another procedure. So that's exactly what we did. We left these 2 in the back. Very infrequently will we have a case in which we can't add those during the day of the procedure, the initial surgery. But in his case, the safe route was to bury them, and ultimately we didn't use them, but it's always nice to have them. And here is his photo of his afters. So he wanted a nice white smile, and we gave him just that. Big smile, and he is a very happy guy. Here's the before, here's the after.